Hi everyone. Today we will discuss about the carbonic anhydrase inhibitors and osmotic diuretic in details. So first let us begin with the carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors include acetazolamide, dorzolamide, brinzolamide. These are the weak diuretics, so these drugs are not used for the diuretic purpose as tolerance develops within 2 to 3 days of its use. Now these drugs acts on the proximal tubule and they inhibit carbonic anhydrase enzyme which ultimately blocks the reabsorption of the bicarbonate ion and it prevents the sodium and H plus exchange. So the ultimate pharmacological effect of this drug is it can alkalinize the urine, it will induce the sodium excretion and bicarbonate excretion, so that is sodium bicarbonate diuresis, and it will also result in metabolic acidosis. So this was about the mechanism of action of acetazolamide which acts by inhibiting the carbonic anhydrase enzyme in the proximal tubule. Now coming to the therapeutic uses of the acetazolamide. So these drugs are used in the treatment of the glaucoma as it decreases the aqueous humor formation. These are also used for the alkalinization of the urine as it promotes the excretion of the acidic drugs. These are also used in the acute mountain sickness, and acetazolamide is a drug of choice for the treatment of the acute mountain sickness. Acetazolamide is also used in the catamenial epilepsy, that is the epilepsy which occurs during the menstruation. So these therapeutic uses you can remember with the help of very easy mnemonic, and that is GAME, and I have already explained what each alphabet means. Now coming to the carbonic anhydrase inhibitors side effects. So these are the sulfonamide derivative and it can result in a bone marrow suppression, metabolic acidosis, and it can also result in hypokalemia. Acetazolamide is contraindicated to use during the active liver disease. During the active liver disease, the ammonia, it cannot be excreted easily into the urine because of the alkalinization of the urine, and this ammonia will cross the blood-brain barrier and it can result in hepatic encephalopathy. So remember, in active liver disease, it may progress to the hepatic coma and ultimately encephalopathy can occur. So acetazolamide is contraindicated to use during the active liver disease. Now coming to the osmotic diuretic. So first of all, osmotic diuretics characteristics. Osmotic diuretics are the one which are freely filtrable. There is a little or no tubular reabsorption, and these are the inert or non-reactive substances. Osmotic diuretics are resistant to degradation by the tubules. So these are the important characteristics of the osmotic diuretic. Mannitol is a prototype in the osmotic diuretics and others are the urea, glycerin and isosorbide. Out of these, the most commonly used osmotic diuretic is mannitol. Now coming to the mechanism of action of mannitol. So mannitol mainly acts in the proximal tubule and in the descending limb of the loop of Henle. Osmotic diuretics undergoes free filtration in osmotically active concentration, and osmotic pressure of the solute will prevent water reabsorption and ultimately that will increase the urinary volume. So these drugs will ultimately increase the glomerular filtration rate and it also increases the renal blood flow, especially to the medulla. Now coming to the therapeutic uses of the mannitol. These drugs are used in the treatment of the acute congestive glaucoma in case of the head injury and in the stroke because these drugs can result in reduction of the intraocular pressure. Mannitol can also result in reduction of the CSF pressure and volume. So that is the reason it is used in case of the acute congestive glaucoma and during the head injury and stroke. Mannitol is also used in case of the rapid hemodialysis or in case of the peritoneal dialysis because mannitol can counteract low osmolality of the plasma and extracellular fluid volume. To maintain GFR and urinary flow in impeding renal failure, for example, in case of the shock or cardiac surgery, we can use osmotic diuretics. Acute renal failure is already established, then you cannot use osmotic diuretic and it has no role in case of the acute renal failure or acute renal insufficiency. So osmotic diuretics basically expands the extracellular fluid volume by drawing the fluid from the intracellular compartment. Now coming to the side effects of the osmotic diuretics, most common side effects include headache and vomiting, sometimes hypersensitivity reactions. Glycerin, when it is metabolized, it may result in hyperglycemia and glycosuria as a side effect. Now coming to the contraindications of the osmotic diuretic, this include renal insufficiency, acute tubular necrosis, anuria, pulmonary edema, acute left ventricular failure, congestive heart failure, and cerebral hemorrhage. In all these cases, you cannot give osmotic diuretic. Now let us simplify the sides of the different diuretic action with the help of this figure. So as we have seen, osmotic diuretic, they acts on the proximal tubule and in the thin descending limb of loop of Henle. Carbonic anhydrase inhibitor, they also act on the proximal tubule. Then the loop diuretic, they act on the thick ascending limb of loop of Henle. Thiazide diuretic, they act on the distal tubule. Potassium sparing diuretic and renal epithelial sodium channel blocker, they act on the cortical collecting duct. So this is the summary of the sites of the different diuretic action. If you like this video, share and subscribe my channel and follow for more pharmacology related videos. Thank you.